Welcome to Talkin' Unfiltered.
We're your hosts, Caroline
and Sharon.
And today we have a special guest, Dr. Brendan Elnekaveh. He's one of our leading plastic surgeons here.
We're so happy to have you.
Thank you.
Dr. Elnekaveh specializes in face, breast, and body contouring. He actually went to Cornell for his undergrad, his general surgery residency at Mount Sinai, and he went to Harvard for his plastic surgery residency. Wow. Very impressive.
That's amazing, actually. That's why he's one of the leading surgeons here. And for today's episode, we have a spicy one, and we're going to talk about everything that happens before, during, and after surgery, the things that really don't make it into social media. Are you ready, Dr. Brandon?
Yeah, I'm excited. This is a great topic.
Let's dive in. Let's dive into the first segment, which is going to be the fantasy versus the facts. We see so many patients come in here, they think surgery is a one-stop shop, there's no recovery.
Yeah.
What would you say some of the biggest misconceptions are?
Yeah, absolutely. There's a lot of misconceptions surrounding plastic surgery. One of the things is in terms of recovery, it's very important to be able to be around someone to recover, have a little bit of help, and take that time for yourself. So there are certain procedures that are really going to be very quick, and certain procedures are going to take some time. Usually it's going to take about 6 weeks with no real strenuous activity or exercise to really get to that final point where okay, now we can do everything, our usual activities, exercise, lifting, and everything like that. But before that, a lot of times it's about 2 weeks of just taking it easy, always walking, stairs are always okay. So that's basically the recovery. In terms of misconceptions with certain procedures, one stands out is liposuction. A lot of people think liposuction, it's just very quick, there's just a couple of little holes, it's not that invasive, the pain isn't too bad, but in reality, it's a lot to recover from, especially when we're doing lipo 360, high volume liposuction where we're taking out 4 liters of fat.
Wow.
There's a lot of fluid shifts. There's a lot for the body to recover. It kind of feels like, a lot of patients tell me that it feels like they did 1,000 crunches in the gym after not going for a little while. So it can be substantial, and that can last. I've had patients taking Tylenol or Advil even a few weeks after liposuction. That doesn't mean that it's the most difficult thing, but it's not like something you come in, go home, and you're totally fine because you had a couple of holes and a little bit of fat sucked out.
Right. Sometimes people can think oh my God, I'm going to see results right away. I'm going to wake up and I'm going to be snatched, and it's going to be no, calm down. It's actually a process.
Right. There's some swelling involved. That takes a few weeks to go down, and you don't even see your final result until a few months later.
Wow.
Are there any other misconceptions that you wanted to add?
Yeah. For instance, breast augmentation. I think that's one that happens a lot. Patients are seeing a certain size of breast online, or they see how many cc's someone else got, and they're like, I know what I want. I want 325 cc's. I want high profile. I want to go under the muscle. I want and you have to understand that everybody's anatomy is different. Everyone's coming from a different starting point. Their breast can be wider, or more narrow. They can have more breast tissue. They can be more active patients that you don't want to upset the pectoralis muscle. You want to be able to put the implants instead under the fascia and let them be able to move. And also that the same CC for one patient is not going to translate to the same exact breast on the other patient.
Right. I always have friends that they ask me oh my God, when they find out I did have surgery, it's they ask me how many cc's, and I'm I'm going to tell you, but just talk to your surgeon. Talk to the surgeon. They're going to know what's best for you, because even my story is I went into surgery without even knowing how many cc's because I trusted my surgeon, and he made a very good explanation and wanting elegant results because I'm tall and I'm perfect. They look natural. I absolutely love them, and I think that's the way that people should go off on that, trusting your surgeon, talking, and they are the professional. You guys are the professionals at the end of the day, so we should have that connection with you guys for sure.
That's not to say that inspo photos aren't helpful, because at least we can talk objectively about what your result is or what your expectation is for a certain result, and that's really helpful for us to be on the same page, because one of the most important things is not only trust between each other as a patient and a physician, but also just understanding what we're talking about in terms of, you know, results and expectations.
Right, right.
How do you feel about combining procedures? I see it's very popular now. We saw Kris Jenner. She got multiple procedures that was completely transformative. What are your thoughts?
Yeah, a lot of times you can combine procedures. It depends on, you know, it depends on several factors. First, how healthy is the patient, any medical problems, their blood work and stuff like that that precludes us from having a really long surgery. Second would be the length of surgery and the types of things we combine. We don't necessarily want to combine things that are going to be opposing. So some people might want like a tummy tuck, but that's going to maybe oppose with like a thigh lift that the incisions are going to want to pull apart. So you definitely need some time between that. Also, you know, that might be a little bit too long of a procedure and too much recovery, because how can you recover with, you know, your belly in pain, your legs like not being able to move? So that kind of stuff is, you know, you have to take that into account. So a lot of times I won't do, for instance, arms with the belly, because if we're doing a tummy tuck, in order to get up and walk, you kind of need to use your arms to really get out of bed. And if you don't have that, you don't have that dexterity or mobility, you're going to have a little bit trouble healing.
Definitely, and that applies to a lot. So many
Yeah.
patients come in, they want a tummy tuck and a BBL.
Yeah.
And once again, that's unrealistic.
Right. And what you don't see a lot of times on social media and like before and after photos are these, you know, visits to the to the plastic surgeon's office for either touch-ups, revisions, or additive procedures, adjuncts. You know, you might see someone had a facelift, but, you know, weeks or months later they had a CO2 laser that completely transforms the texture of your skin and makes you feel youthful and, you know, does fine wrinkles. And so adjunct procedures later on can also change the result drastically.
That's a great point. There's so many times we don't see a timeline. We see a before photo,
Right.
we see an after photo, and
Right.
you have no idea how much time is in between those.
Right. You don't know if someone got steroids in their nose after, you know, a rhinoplasty.
Mm-hmm.
Most of the times we do that. You don't know if they got a little bit of filler touch-up for a little bit of an indent, or cheek filler to augment that cheek when you do a facelift. Little things like that.
Okay. So, like, actually, like, in coming with all of these social media talk and, like, seeing all these before and afters, like, do you think, like, the biggest misconceptions or unrealistic expectations are coming from, like, social media and celebrities, or, like, what do you think about that?
It's a great question. I think part of it does. I think also part of it comes from, what we see on social media, but part of it also comes from plastic surgeons and patients together kind of pushing the envelope a little bit on what's possible, which is always good because it brings our, specialty more innovation. I think we're always trying to improve. I think that's one of the things that I love about plastic surgery is that, like, I know in a few years from now, the same techniques are not going to be as relevant, or something is going to be improved upon. Though it's always evolving, there are certain standards and ways to be safe. And so we want to push the envelope. We want to innovate and have better techniques, but we also want to be very safe. And sometimes that's just the important conversation to have with your plastic surgeon is like, are we going to be doing this safely with minimal risk of complications and maximum benefit?
Right, not because we see it on social media and you see your favorite celebrity or your favorite influencer just like getting a snatch like this, or because you want to be ready for summer, means that you should put yourself at risk. So definitely talking to the surgeon and having somebody who is actually professional, and they keep the
transparency real.
Yeah.
They keep it real.
They keep it real, and we want to make sure that you are safe, and then that the results are the most optimal. Right?
Yeah.
Definitely.
Very prominent plastic surgeon used to say that after these conferences that we have where plastic surgeons get together and show new techniques and stuff, there's just like a plethora there's just like, unfortunately, a bunch of complications that happen after that because we're all trying to do new things and, new techniques. And so you have to, at the end of the day, you still want to be conservative and careful.
Right. So now let's go and talk into our second segment of today's podcast, and it's gonna be diving even a little bit more into social media versus reality. You know, social media, sometimes we see it. I mean, we see it all the time. We see people using Facetune, filters. We see people, you know, just showing their highlights. And then, you know, sometimes we see transformation without the context. We see the transformation without, like, hey, what happened between that before and after? You know, that little in between. What do you have to say about that, Dr. Brandon?
Yeah, you're absolutely right. There's a bunch that goes into plastic surgery procedures, and you know, it takes time to heal. There's some swelling and bruising that needs to go down, and normal course of recovery, and you're not going to see your result immediately afterwards. The swelling, you know, will go down. It does take months.
Right. No, totally. And just like diving into more, like a little bit more into like the social media aspect and our favorite influencers and the celebrities, do you think that social media is helping or hurting the way people view plastic surgery?
That's a great question. I think it's a little bit of both.
Okay.
On one hand, it's really showing patients what's possible, and you know, I have patients that didn't even know labiaplasty existed until like last year. That was even a possibility, right? And it can give you certain expectations about certain procedures. But on the other hand, it might be a little bit unrealistic. I mean, how often have you seen a plastic surgeon post every single patient that they did the same procedure for in a row? Like, have you ever seen like 100 consecutive tummy tucks from someone who does a lot of tummy tucks? I doubt it.
Wow.
You're gonna see
Yeah.
you're gonna see the 10, 20, 30, not only best ones, but the ones that the patients agreed to show their pictures too.
Absolutely.
So you have to keep that in mind.
Absolutely. And I think it also, like, it not only depends on, like, you know, the surgeon or your work, but also like the amount of work that the patient is also putting in to take care of their results, right? So that's why probably surgeons, they also do not show sometimes the after, because it also is a two-way street. It's the surgeon's work, and then it's also the patient that is working alongside with you to get the results that they want.
Yeah, absolutely. Things like smoking or early activity. You know, I've had a patient who went scuba diving a week after breast surgery. I mean, you don't really want to be doing that.
Follow the instructions.
Yeah.
Wear your fajas if you have to.
Yeah.
No, definitely. And absolutely, I feel social media is the perfect platform to have a good mix of both. So be picky to what you're like.
Yeah.
To what they're consuming. Like, I think that should be like my number one advice to our patients or anybody watching this episode. Like, be picky with what you're consuming, and then also take a lot of notes and follow professional advice at the end of the day.
Yeah. Take everything with a grain of salt, and just know that, you know, on social media, nobody's posting their complications.
Right.
So complications do happen. It's a real unfortunate thing that does happen, but you don't want to go to someone that has no complications, because that doesn't exist. The plastic surgeon who knocks every case out of the park every single time with zero complications, it just doesn't exist.
Right.
But what you want is a plastic surgeon that you can trust, that if those complications happen, they're going to respond to you with, you know, understanding, with compassion, being quick, and know how to deal with those complications to get you through them, so that, you know, you have a minimal scar after an infection instead of something maximal or something worse.
Right. You cannot expect perfection even if like our regular anatomy is not perfect.
Absolutely.
So you shouldn't be expecting or aiming for perfection. I mean, remember, even measurements, and like one breast is bigger than the other one, and like maybe your nose is a little bit tilted. So do not try to reach for, you know, the stars. I mean, you can like have a better, so like you're gonna look 10 times better, and you're gonna feel a lot better with yourself and your self-esteem. But that's something that people needs to understand, that perfection does not exist, and that goes, you know, we tie it back to the whole social media perfect life and highlights and the filters, and
they airbrush and they're filtered, and
yeah, totally.
they have you know, publicists and managers who make sure that the bad pictures don't stay on social media. Like
Right.
these things, they do exist.
Right. So going back to that, how can people better protect themselves for like misinformation online when that happens?
It's just really important to do your research and to find a surgeon that you trust, that you can have a real relationship with, that you understand each other, the limitations, but also what's possible.
Right. And there's never a stupid question, guys. Like always, even if you think it's very minimal, like analyze your lifestyle. Like what sports do you play? If you have a partner, if you're married, when can you have sex? Like everything I feel is like very important to touch base to make sure that you're really prepared for the surgery.
Yeah.
I believe so. Let's dive into the segment 3, and I'm going to pass it over to Caroline so she can discuss a little bit more with Dr. Brandon that recovery that nobody prepares you for.
Yeah, so I don't think patients realize that the journey of having surgery is just as much mental as physical. There's post-op blues. It's hard being in bed for, depending on the procedure, a couple days to a week, being less mobile, not doing the same things that you're used to, same habits. What advice would you give patients? How should they set realistic standards during this time?
First, I want to correct you about one thing. Bed rest. There's almost no procedure where I would recommend bed rest for a week like that. I would say the one caveat is facelift. You want to be extra easy, gentle, lifting things from the floor, but you're not necessarily on bed rest. It's getting up and walking is very important because number one, we don't want a hematoma, which is why we say, or a bleed, which is why we say to take it easy. But more importantly, actually, because a bleed is more easily fixed, is we don't want blood clots. So patients right after surgery need to be mobile, active, stairs, walking, shower, usual activities. Yeah.
How else could patients get out of those post-op blues? Would you recommend having a support system?
Having a support system is very important. Having someone who has had the procedure before and you can kind of talk about what they went through. And definitely communicating with your plastic surgeon, letting them know how you feel. Come to the office more frequently and just say, hey, I'm just not feeling myself, or hey, I'm thinking about this situation or that, and talking it through kind of can really help as well.
I feel like people need to be a little bit more easy on themselves because sometimes, because they don't see the results right away, they kind of start regretting it. And they're like, oh my God, why did I do this to myself? Or why did I spend thousands of dollars into something that didn't even make me happy? And it's like understanding that results take time.
Yeah.
It's not like, again, you're not going to see it tomorrow. You're not going to see it in a week. You're going to see a change, but it's not like the final result. So definitely that post-op blues can be like a little bit tough.
There's a reason why we don't do revisions, for instance, on the breast if it's less than, let's say, 6 months or a year.
Wow.
A lot of surgeons wait an entire year, which makes sense because things change so much over time that like you want them to just fix on their own instead of having a new recovery and then a new normal and then a longer recovery. And
What's something that's tough but totally normal in recovery?
It depends on the procedure, but generally swelling and bruising for pretty much any procedure. A lot of surgeries are going to have some itchiness too, or uncomfortable feeling.
Doesn't that mean it's healing properly?
It can. Like especially the eyes, a blepharoplasty. A lot of patients complain about itchiness, and you can't really rub your eyes, so that's part's a little bit tough. Labiaplasty, same thing, can be a little bit itchy as it recovers. Patients love ice for that situation, both the eyes and the labia actually. Numbness too, tingling, liposuction can really irritate the nerves, so they get a lot of tingling, a lot of numbness, sometimes even shooting pains, but it all gets better after liposuction. Sometimes numbness can be permanent, but it's usually in cases of either a tummy tuck where we know that it's going to be numb between the belly button and the lower incision, and then maybe parts of the breast and parts of the face.
Awesome. Yeah, sometimes I want to add a parenthesis here, and something that I was not prepared was the amount of days I couldn't shower. That was the most terrible part of my whole recovery process. So yeah, those even little things that you don't even think about, I'm like, oh wow.
So shower is one thing that I think a lot of surgeons are you know, they have so many different opinions on it, and it
Right.
also depends on the procedure. Well, I know a surgeon who lets you shower a day after a facelift, but I don't let that. I don't let my patients do that necessarily because, you know, I've had an experience where a patient showered and then had a bleed. So you know, a lot of things come from experience, and so I like to wait a little bit of time. And the second reason I like to wait is because I also do a larger dissection than that surgeon. You know, so my area for having a trouble is a little bit wider. You know, my dissection is wider in the neck, and you know, my pull is a little bit different, and so all these little nuances can lead to different post-op instructions from different surgeons too.
Interesting.
That's why you always listen to your surgeon.
For their experience, and also because they may do a technique that might be different from another surgeon.
So actually, let's dive into our segment number 4, and we're gonna talk about how results actually take time. We need to emphasize this one because I have seen patients here that they're like, oh my god, why is my nose so swollen? No, this is not what I wanted. And it's like, can you just wait?
It hasn't even been a month.
Right. Right. Can you just wait? It's gonna be amazing. You just need to trust the process.
Absolutely.
Yeah,
and it
and do
depends
your
on the
research.
procedure. Yeah, absolutely. Like for noses, the swelling can take a whole year, really 2 years.
Wow.
You know, especially with an open rhinoplasty to see the final result. With the breast, you know, the implants are going to be sitting high and up for a little while. It takes a few months for them to drop, but then again, like about a full year until you see your final result.
Wow.
So you have to be patient.
Yeah.
Yeah, no, and that kind of answers my question on like how long should a patient wait until like before judging their results or before judging their surgery?
I would say at least a few months, depending on the procedure, and then just know that things may still settle and change, but less so.
They can have
as
like
the
a good
time
idea.
goes on. Exactly.
Okay, perfect. Yeah. And like what do you think it's a healthy mindset, like a healthy mindset looks like post surgery? Like what's a good attitude to go by, you know, after you get out of the surgery room and you're recovering and you're just patiently waiting for the results?
I think it's really important to have a positive mindset. You want patients to, I mean, you definitely want to understand that things are going to take time, and there's always have in the back of your mind that there's always a possibility to fix something, but that not necessarily the first thing you see right out of the operating room is a problem that needs to be fixed, but rather I would say 90+% of the things are going to, you know, evolve over time to the point where it's not going to need any fixing. So having that positive mindset is really important.
Remember, good things take time, so do not rush your recovery
Right.
journey.
Now that we've talked about a healthy mindset, let's move into the final section, which is about choosing the right surgeon and why transparency is so important. There's a lot that goes into a patient and a
Yeah.
surgeon. There's chemistry, there's honesty, and there's trust. It's not just about finding a viral person online and picking him. There's a lot more that goes into it, him or her.
That's right. You definitely want someone who has a similar aesthetic to you, who has the ability to deliver the type of result that you want, and you also want to make sure you're on the same page. I think it's really important that your surgeon goes over the risks and benefits of each procedure and also the alternatives that are available. You know, it's not just you want implants for your breast and then you want silicone and that's it. Like, I think it's important to talk about, like, you know, there's also fat grafting, there's also saline implants. Why choose one over the other? Why go under the muscle or over the muscle? Why choose a certain incision? And I think having those conversations is really important. Talking about the risks and what to expect. You know, I had a patient who had a tummy tuck by a previous surgeon, and she was telling me, I'm still numb underneath the belly button to the lower incision. I'm just like, well, every patient is. There's virtually no patient who has sensation in that area, and her surgeon didn't really talk to her about that possibility.
Wow.
So little things like that. It's important to get all the information.
Yeah, and you definitely want to find someone you're comfortable with as a
That's right.
patient, find a surgeon you actually trust, you can ask the hard questions, you could be completely transparent with.
Right.
Because at the end of the day, that's going to help your result.
Right. And tying it back a little bit to our first episode, that if you haven't checked it out, it's already live on our YouTube channel. It's everything that you should ask and how to prepare for your first consultation. But now, Dr. Brandon, now that we have you here, what do you think are the right questions to ask during a consultation?
I think at your first consultation, you want to talk about what exactly bothers you.
Okay.
Okay. Name a few things. Okay. Usually you can't take care of like 5, 6, 7, 8 things. I would say, 2 to 3 things that bother you about a certain body part. And then say what you're hoping it can look like, either with inspiration photos or just describing and making sure that your surgeon understands that. And then asking what are the potential alternatives, why not do a certain technique or a certain thing in this situation, and the risks involved, what can be expected in terms of like what complications are possible, how frequently the surgeon has seen them, what they've had to do to address them, if something, how often did you have to go back to the operating room for a certain case, and then when they can see the final result. So, asking like, so when am I going to see the final result for my breast augmentation and lift? And once you have that idea in your head that this is going to take 6 months or however long it's going to be, I think it puts you a little bit at ease to know that like you don't have to be looking in the mirror and making sure every day that like, oh, did the implant drop yet? Did the implant drop yet? Or and so on, because it takes 3 to 6 months.
Right. And having that trust in your surgeon.
Mm-hmm.
With your expertise, what would make someone mentally a good candidate?
I think if they're open and willing to take suggestion from the plastic surgeon and not coming into the consultation with a closed mind that, this is exactly what you want and this is exactly how you want to achieve it. Just listening and getting advice from the surgeon, I think, is really important, and being open to those suggestions.
I don't think Dr. Brandon can actually make me look like Lindsay Lohan, so we don't want to have that argument over here. So, to wrap up this whole episode, because today's topic has been completely amazing, and I just really hope it reaches the right audience, and we are able to walk you through, to make the right decision for a life-changing experience, like it is plastic surgery. What's like an actual final truth bomb that you want to give to your patients today?
Take everything you hear and see with a grain of salt. Make sure that you have an open and honest conversation with your surgeon, and know that results take a little bit of time.
You heard it here from Dr. Lottie.
Remember that surgery isn't just a glow up, it's a whole process. It's a process between your surgeon, it's a process with yourself, and it's just a journey. You have to enjoy it, and you have to be mentally prepared for it.
Absolutely.
Enjoy the ride through all the bumps.
That's why we have professionals like Dr. Brandon here at South Florida Center. You guys are going to be able to actually book a consultation. It's free. We're gonna leave you the link down below of her video. And just for a little bit of a teaser for our next episode, we're actually bringing someone that will represent today's topic.
It's actually an influencer we've worked with. So if you have a guess, comment below and let us know.
We're so excited to have her on the next episode. And don't forget to like her episode,
follow our social media,
and subscribe.
And we'll see you in the next episode.